join us in a moment. So
Yeah, please
I'll
start.
start just by introducing Dr. Susan Mercado, our DPM here at Wipro, who's going to say a few words of welcome and also a few opening remarks. Over to you, Susie.
Thank you very much, Sandro. So, colleagues, welcome to this crucial gathering where we come together to address one of the most pressing challenges of our time: sea level rise in health. As highlighted in the Intergovernmental Panel on Climate Change, or the IPCC assessment reports, the consequences of climate change, particularly the rise in sea levels, which is experienced in this region at 3 times that of the global average, stands as a stark example of the urgency required in our efforts. Our discussions today will focus on the immediate and long-term health risks presented by these challenges, including the increased prevalence of infectious and vector-borne diseases, threats to food security, and displacement of communities. It's paramount that we consider these factors in our climate mitigation and adaptation strategies. As we deliberate, we must recognize the recent review revealing 62% of healthcare facilities in the 14 Pacific Island countries are perilously close to the sea or rivers. This exacerbates the challenge during extreme weather events, and this alarming statistic underscores the need for a coordinated international response. Today, we are presented with a unique opportunity to advance the initiative for an international protocol that specifically addresses health concerns related to sea level rise. And I was just going to say that when we first talked about this, it was Dr. Kreisel who raised the idea of, shouldn't we do something with ACE on that's within the context of the UNFCCC. And I think since that time, this has matured, and with thanks to Sandro, I think we have progressed. And I am looking forward to hearing everybody's ideas about how we get this done. Definitely for the Pacific Island countries, this is an existential issue. I think for cities in the region, in the Philippines, for example, 70% of people live in coastal areas. And for the cities of Asia that are on the continent, that's millions and millions of people who are affected by sea level rise. So looking forward to our discussion. And thank you for your commitment and your precious time and participation. And together, I think we will come to a meaningful impact. Thank you very much. Sandra, over to you.
Thank you, Dr. Susie Mercado. And I'll just acknowledge also your leadership as an academic, as a policymaker, and of course in WHO, this is a topic that I know you're very passionate about. And I think without your energy and driving force, we wouldn't be having this conversation. Also to Wilfred, to Dr. Kreisel, for giving WHO the nudge, and of course to Jinwan and the team who make the magic happen and bring us all together and make it possible from a Secretariat perspective. My name is Dr. Sandro De Mayo. I'm 4 weeks in as the director and the head of the Centre for the Asia Pacific Centre for Environment and Health in the Western Pacific, based in Seoul in South Korea, and part of obviously the Western Pacific team. Very proud to be back at WHO. Thank you to all of our experts for joining. It's a very busy, very uncertain time in the world and also in global health. And I think we're also always extremely appreciative that global experts like yourselves are able to join us, not just at short notice, but in this busy time to have this critical conversation. And as Susie said, really a crossroads conversation that's so important for our region, but so important globally. And I was reminded by Dr. Mene when we spoke just a few weeks ago that this is truly a global challenge that we need to keep front of mind. So we've got some time together today, and we really want to get to the presentations fairly quickly. I'll ask everyone to do a very, very short introduction in a moment, but just to remind you of the purpose of this meeting. As Dr. Mercado said, we're exploring, in the context of the urgent challenge of sea level rise and health, we're exploring the development of international protocol to integrate health into climate adaptation under the UNFCCC framework. Obviously, you know, the possibility of COP31 being in the region next year is something that we should keep front of mind as a critical stepping stone and acceleration point. Also, that just this year, at the Regional Committee meeting of the Western Pacific, we will have the regional roadmap, a translation of the Global Action Plan, as well as ACE's new 5-year strategy being presented and tabled. We know that this is a priority for not just Dr. Tedros, the global level, but, you know, I'm very proud to work for Dr. Saya Piakala, the region's first Pacific Island regional director. And for our RD, in fact, just this morning, he was reminding us that this is not some esoteric future challenge. This is a very real challenge, a very personal challenge for him, and one that he experienced as Tonga's health minister and as a medical doctor living and working in the Pacific himself. Over the next hour or so, we're wanting to sort of do 4 things. The first is really explore the scientific foundation for establishing an evidence-based framework using IPCC findings, integration with the UNFCCC and aligning with existing adaptation programs, exploring what it looks like to take a multi-stakeholder approach, engaging affected countries and international organizations. And I suppose most importantly for us is, you know, what practically is WHO's role, and how do we do that effectively and efficiently in the context of urgency, but also of complexity and uncertainty. Finally, the expected outcomes from today, really wanting to listen to all of you as global experts. It is a strength of WHO, our convening power, but at the end of the day, it comes down to the incredible brains that we're able to tap into and learn from, and that's all of you starting to think about some strategic pathways for health-focused climate adaptation, and of course, strengthening global collaboration and advocacy. So with that, we'll do a very quick round of introductions. If you can just say sort of who you are and where you're from, and maybe if you want to add a very quick reflection on why this is important, you can, but we want to keep it quite short so we can get to the presentations. And I'm going to hand straight over. We'll ask you to say it and then hand over to someone else on the screen. So I'll, as I said, Dr. Sandro De Mayo, I'm the director of the Asia Pacific Centre for Environment and Health, and I'm going to hand straight over to my good friend from Fiji National University, Professor Donald Wilson.
Thanks, Sandra. Mbulavanaka, everyone. I'm Donald Wilson. I direct Fiji Institute of Pacific Health Research, which is based at the College of Medicine, Nursing and Health Sciences at the Fiji National University. I'm a public health physician by background, epidemiology, toxicology, and occupational health. And, you know, just dabbled in a bit of work. I've worked with Rocco before, and I'm hoping that our recent sort of engagement in planetary health might contribute to the discussions that we have today. It's a pleasure to meet everyone. I'll hand over now to Jose.
Yes, thank you very much, and good morning, everybody. My name is Jose Romero, Spanish name you can pronounce how you prefer. I work for the Swiss government 25 years. I'm a physicist by training. I was in the Swiss administration, the focal point for IPCC, but also IBES, the platform for biodiversity, and also the focal point for the UNFCCC. I participated to a number of negotiations, in particular the Kyoto Protocol and all these processes under the UNFCCC. Currently, I'm retired. Even retired these last 2 years, I had the opportunity to lead the technical support unit for the synthesis report of the 6th assessment report of the IPCC. And well, thank you very much for having me. And I bring some experience as a bureaucrat with a good knowledge of processes in governance, but also on scientific matters. On climate change, biodiversity, and even the Group on Earth Observation, which is also based here in Geneva, sharing data and promoting access to information. So this is my expertise, and once again, thank you very much for having me. I hope to be useful in making proposals and indicating ways forward for some processes. Thank you.
I'll hand over on your behalf to Professor Kim from Seoul National University.
Hello, everyone. My name is Ho Kim at the School of Public Health, Seoul National University. I have been studying the association between climate change and various health outcomes. I have a statistics background. So personally, I'd like to gather as much as possible data and then produce some scientific evidences of this problem. I'm very pleased to join this team and hope to contribute in the future, especially in terms of providing more evidence to the international society. Thank you.
Excellent. Bettina, over to you.
Do you hear me?
Yes, we can.
Good morning to everybody. So my name is Bettina Menne, and I'm currently the Senior Policy Advisor of the Healthy Cities program in WHO Euro. I worked on climate change some time ago, directly for almost 20 years, between 1997 and 2017. Engaged in a number of IPCC assessments, even the most recent one, and numerous policy developments, specifically in Euro. And I'm very happy to see a few friends online from Jose. Great to see you. Wilfried, of course, Rocco, Chris Ebai. I mean, it's great. Susan, of course. Great to see you.
Excellent, thank you. And I'll hand over to Christy Ebby, who we're yet to properly meet, but I've heard so many good things and read a lot of your work. So it's fabulous to have you here alongside so many other wonderful experts. And I'm conscious it might be a strange hour of the day. I'm not sure exactly where you are in the world, but thank you for joining us. Over to you.
Yeah, thank you. And apologies that for some reason I can't turn my camera on. I don't know what it is about Zoom and Teams, but they always find new ways to make our lives more interesting. And yes, it is quite late at night here. I've been working in climate change and health for 30 years now. Worked with Bettina Menne at the beginning. Sorry, it's quite late. Worked with Rocco for many, many years. Worked with Jose, it's great to see you again. And it's been quite some time since we had opportunities to interact. And Celia, sorry I missed you last time I was in Melbourne. And why don't you go next, Celia?
Hi, everyone from very hot Melbourne. I work at the University of Melbourne. I'm a human geographer, and my work primarily focuses on climate change-related migration and relocation in the Pacific Islands, but I've also worked across Alaska, Australia, and the Maldives. So touching on health more in well-being and loss of disruption to place attachment, and then specifically health indicators, but it's an area I'm really interested in.
Excellent, thank you, Celia. Ivan.
Thanks, Sandro. Staying in Australia. I'm in Western Australia.
Okay.
Ivan Hannigan's my name, and I'm the director of the WHO Collaborating Centre for Climate Change and Health Impact Assessment, rebranded from the WHOCC for Environmental Health Impact Assessment, which you may remember my predecessors, Jeff Spickett and Helen Brown. But I come from a human health risk assessment background. I was remembering in 2003, I worked at the ANU on the Human Health Climate Change Risk Assessment for Oceania report for the Commonwealth Department of Health, and subsequently several things built up to the Garneau review for Australia. And that's the role that the WHOCC is playing, risk assessment and health impact assessment we teach, and we coordinate HIA practitioners across the region, the Asia Pacific HIA practitioner network is something that we're trying to support to bring everyone together in this important space. Great to meet you all.
Excellent. Thank you. Professor Mayong, do you, I know you've already said hello, I think, from the beach. Who have we missed so far? Rocco. Apologies. How can we forget Rocco? Over to you.
No problem. Hi, good morning, good afternoon. My name is Rocco Kim. I'm currently working as a senior advisor for the Seoul Center on a short-term consultant contract. Yeah, it looks like I know most of you. Actually, I was teaching in the university together with Ho Kim about almost 30 years ago. And then joined WHO working with Bettina in Bonn office. And then in Fiji, I worked with Christy Bai and also Donald Wilson, even though I worked with him already from Bonn office. And then also Wilfried as well. And then while I was in Manila, I contributed to establishment of the center with Wilfried help and also Susie's guidance. And it's really wonderful to see you all here. Yeah, over. Maybe over to maybe Sora.
Thank you very much for calling. Hello, everybody. My name is Sora Kim from ACE office. I'm the secretary here on supporting administrative works. Thank you very much, and it's really a great pleasure to meet you all. Over to Jinwon, please.
Hi, good to see you all. I'm Jinon from work with Sandro and Sora in WHA's office. Good to see you. And I would hand off to Wilfred.
Thank you. Good morning, everybody. Well, I'm Wilfried Kreisel. I joined WHO in 1977 as WHO's first air quality management advisor. And with many years in Asia, I moved to headquarters in 1986 and was the director of the Division of Environmental Health. And then the Director General decided to give health and environment a huge priority in WHO when he decided to establish a commission on health and environment and development, which was a crucial decision because it put health squarely on the Agenda 21. Maybe some people may remember. And he also was the person who then gave climate change, actually in the mid-90s, an important role in WHO. I had the privilege also to convene the first expert committee meeting on health and climate change, actually the potential health effects of climate change in 1989, a time when we all knew what consequences climate change would have on health. I'm very happy to see that we moved a long way and discussing now a legal instrument to put health at the central role of the adaptation and mitigation efforts of the UNFCCC. Thank you very much for being here.
Thank you. Thank you, Wilfred. I think that's everyone. So we might now, I'll hand over for our reflections, part one and first reflections from Jose. You're just on mute, Jose, but I don't know if you are sharing slides or if Jinwon's doing that. Oh, yep, there we are. Fabulous.
Yeah, here we are. So some of you have already referred to the key objectives of this meeting. I just, for the record and keeping track of what we are discussing, I refer to the background paper you have received. So strengthening scientific foundation for WHO work on climate change and health, integrating this work within the UNFCCC process. We're going to see how it could be possible. And of course, through a multi-stakeholders approach, and defining more precisely the role of WHO. Once again, I hope that my microphone now is working well, and I hope you hear me well. Thank you. So I go to the next, if I can. Yes. So the scientific foundation. Just recalling what the sixth assessment report of the IPCC has identified as impact of climate change and sea level rise on human health. I will not go through the list. Once again, it's for the record. You know that, but you have with these bullet points the sectors where impact of sea level rise and rising temperatures and all the consequences of climate change are impacting human health. So it's obvious that in this context, the WHO has a contribution to do to this landscape, which is the scientific foundation for action on health in the context of climate change. Many actions are possible. Just pointed out a few of them here. So promoting monitoring, observation, modeling, and research on these matters, using the best tools. And most important also is to collect information on effective adaptation policies that can be replicated. So good practices is always a good task. And in this context also keeping its role of the central process for health in the world, participating in processes and collaborating with institutions that are relevant to this task. So this is so very broadly how WHO can contribute. Just allow me to mention that last week the IPCC adopted the outline for the 7th assessment report, and in working group 2 dealing with adaptation there is a dedicated chapter. I don't yet have the final wording because it has not been posted in the IPCC website, but this is what has been proposed for this chapter 19. And working group 3 on mitigation is also assessing impacts and associated benefits on health from various sectors, transport, energy, etc. So once again, WHO has a role to play, which is of utmost importance, nominating experts, contributing with data and information, reviewing the drafts, participating in the sessions of the IPCC dealing with these matters. Let's go now to integrating this work within the UNFCCC process. You know that health is not currently a specific item on the agenda of the UNFCCC bodies. So, and the options we are going to present here are two. One option is a protocol, a treaty, which is focused on climate change, sea level rise, and health. Another option is to have a broad joint, meaning in that this context that both subsidiary bodies are contributing, the scientific part, SAPSTA, and the implementation part, the SBI, a joint cross-cutting work program that will address climate change, sea level rise, and health. Just for the record and not to forget it, there is a lot of climate change litigation around the world, currently more than 1,400 cases. But we may consider that litigation is probably not the best way to advance ambitious commitments. to be discussed, but I have documented this with some slides you will see later. So let's go to the first option. So a protocol. You know, a protocol is a treaty that needs a number of steps, negotiations for defining the objectives, the means of implementation, the way it's help with processes including funding for developing countries. And the adoption of such a protocol needs a consensus, and its consensus is reached in a conference of the parties after some years of negotiation. And the entry into force of a protocol happens after the ratification, maybe some conditions for entry into force, a minimum number of parties having ratified and so. And you know the traditional structure of the protocols under the UNFCCC. We have two of them, the Kyoto Protocol and the Paris Agreement, and the structure is always the same. Objectives, means of implementation, process of transparency, monitoring, reviewing, and verifying, and evolution is possible, incorporating latest scientific information, etc. The status is a strong status for a protocol or another agreement.
I know, I was there too. Sorry.
Yes, yes. Oh, okay. And the legal status is a very strong one because it's a legally binding instrument once it's into force and the parties have ratified it. The second option would be a program of work under the UNFCCC. So there, again, parties decide what has to be dealt with, joint work by parties. The mode of adoption is a COP decision, which is a lighter process, although there may be a lot of discussions. There is no entry into force process. It's just after adoption of the COP decision. And the program of work has an architecture that may be very flexible with objectives, with ways to cooperate, ways to support parties and so on. And the status is a not legally binding status. So best efforts, participation according to national circumstances. Allow me to be a little more explicit on what a program of work under the UNFCCC may be. We have a list here of existing programs of work, and I can even provide more information on what these program of work contain or aim at. We have programs of work for mitigation, for adaptation. We have processes where the local communities and indigenous peoples are involved in the process, and we also have processes that take care of gender considerations. So this is a list of programs of work, and if we were to install a program of work on health, it would have to collaborate and benefit from synergies with these programs. There are pros and cons for both options. A protocol, once into force, is a very strong instrument, and we may expect a strong implementation. The cons are that it could be a very difficult process for adopting such a protocol. A program of work is, in that sense, more flexible. No ratification is needed, easily amendable by the COP, and it may trigger collaborations with organizations outside the UNFCCC. The cons are that it not being a legally binding instrument, the implementation may be loose, and the means of implementation may also be lacking. An example of such a program of work is the Nairobi Work Program. Why I mention that here? It's because it's the program of work that contains health explicitly in its thematic work areas. The Nairobi Work Program is now running since many, many years, and basically consists of parties raising issues for which they would need help from experts for better understanding the situation, better assessing risk, better implementing policies. And these experts in the pipeline provide these inputs, and parties can, on this basis, better implement their policies. WHO could, of course, find very easily a niche and a way to contribute to the Nairobi Work Program through its expertise and its knowledge on adaptation related to health. I will not spend time on these 3 slides on climate change litigation, definition, legal action areas. Here, another list of areas, and some cases are listed here, including the case of the ladies from Switzerland, the grandmothers from Switzerland against the Swiss Confederation that they won in the European Court of Justice. Because Switzerland was accused not to do enough for climate policy. Well, just for the anecdote. But as I said, there are many cases around the world that are interesting. So no need to mention that, of course, to work and mainstream health issues in the UNFCCC process, WHO will engage in a multi-stakeholder approach with a broad coalition of countries and organizations, and in particular the European Union. And again, no need here to expand much because you know the mandate that the 77th gave to the whole organization on climate change and health, and reacting to this mandate, WHO has established a draft global action plan that will be still consulted. This is the last decision of the executive board, beginning of February, and will be put for consideration by the next World Health Assembly in May this year. And again, no need to expand how WHO role could be in the current UNFCCC programs on mitigation, on adaptation, and the processes. These 2 slides sum up this. Now, trying to go to the operational way and the way forward and the expected outcome from this meeting, I have put together here a timetable and steps for this year and very shortly for next year. These are concentrated, these steps and actions are concentrated around IPCC, UNFCCC, and WHO meetings where the action could be envisaged. We can come back to this table once again with the aim to be very operational in this meeting. We go to hopefully the establishment of an expert team as a decision of this meeting. This expert team having as a main task to establish a roadmap, and this roadmap can consider what I have shown in the previous timeline. The expert team, once again, main task is to develop this roadmap and identify objectives, actors, ways to work in the next months. And that's all for the time being. Thank you.
Thank you, Jose. We'll keep moving, and I'll hand straight over to Dr. Bettina Mene for her reflections as well.
Just a moment. Yeah, Jose, super thanks. I have a number of comments. Unfortunately, I didn't have a lot of time because yesterday night to go through the presentation. My first question is actually more for Sandro and Susan on the scientific foundation, but also to Jose. My question here is, where could we best collaborate in order to make an assessment available on the sea level rise and its health impact? So I think there are two options. The first one is, of course, something you had already in mind, which is a Lancet Commission related activity. The advantage of this is, of course, it can be rapidly put together by us, by WHO, by experts, by the Lancet itself. It doesn't go through a government approval process. It's a document, you know, you can most likely within a year, more or less, roughly speaking, developing, and it can include, of course, huge amount of experts in the world. Another option, and that's a question to Jose, because I'm a bit out of the IPCC at this moment, has there ever been a special report on sea level rise of the IPCC? Because if there would be or has been, then we could be extensively contributing. That would have an advantage that it goes through a government review process and has the advantage of highlighting particularly the needs of certain areas. This brings me up to the question of scale. And the question of scale is of course, the geographic scale and the temporal scale. While you have some countries and some areas which are already affected, some other areas like Europe, European areas, for example, United States, American areas, are likely to be affected in the future. So you have the current really urgent needs, as well as your forthcoming future generations or future decades needs. The other question is, of course, what should be included? And I think you made a nice table of content. However, there are other health-related issues which I think one would need to decide on what is it, like health systems problems, resilience of health systems, actions to be taken, etc., but also the human rights aspects and the people, the specific vulnerabilities related. So that would be on my side. So where is it for? What is the best to do under the current situation? On the UNFCCC, I am a little bit, how can I say? I have been probably at 15 UNFCCC meetings, participating also in Nairobi program development, etc., along with others which are in this pool. The current geopolitical situation is a very difficult situation, as you well know, in terms of United States dropout, in terms of maybe boomerang effect related to other member states. But what more worries me is this huge negotiation process, which takes a long time, even if you have all the 6 countries which would be coming together to raise enormously the awareness on getting this done. So this is a long process, and I don't know, Jose, how long it did take to develop, to have the Nairobi program of work approved at the conference of the parties, but probably it took a number of years. So, and then it's not only this one, it's also the question, how far can you actually go with a specific protocol? Is it you're really going into the litigation direction you would like to see? Is it you're getting a compensation mechanism for those who are losing their homes or their countries? I mean, these are all questions which would be raising enormous amount of negotiations. Let's put it like this. So I'm a bit afraid about this long process it could take and water down in the negotiation process. I like the idea of a work program because it's more rapid, but as said, it doesn't have a legally binding relevance, but it could be much more rapidly developed, raising still the attention to the problem and maybe having a few countries much stronger coming up into proposing a legally binding document in the years to come. The question is, how far can we go with this? What could be the added value of developing this for the health and for the people, underlying the word peoples here? So I think this needs to be a little bit more in this roadmap to really the pros and cons worked out for our people. This is the main point, and the vulnerabilities related. Yep, these are my first comments, I would say. On the WHO, I mean, I don't think we have a global, our team from Geneva present here. But, you know, WHO has been putting not only the forthcoming action plan, but we have in the new global program of work, number 14, climate change is a priority. It's one of the 6 areas. So within those, we are already working with the countries to develop, for example, national climate plans. This is one of the potential deliverable by countries. So sea level rise would be one of the issues definitively to put into the country's action points in those countries developing it. There's also some specific work ongoing in the Attach, for example, but also in the different regions, there are several activities. So in our case, in the Euro region, we have the Budapest program. And within the Budapest program, one of the issues which has been developed is the environment and health partnerships. And we are having a partnership on climate change now, which is led by Ireland, where specific aspects are addressed, such as environmentally sustainable health system, climate resilience, resilient health systems, just to give an idea, but also working on the whole adaptation stories from heat over to flooding, over to infectious diseases we were mentioning. So I think we would need to consider the specific regional needs, but also embed it into ongoing activities beyond what is now the climate action plan, specified to the needs of our people in the different countries. Don't know whether I made this clear. So there is a lot happening and a lot ongoing, much more than at my times, my earlier times. And I think it requires a deep discussion within WHO on how far can we actually get a stop here.
Great, thanks, Bettina, really helpful. Maybe I'll start by just clarifying one thing, and then I'll hand to Susie and Jose to provide any reflections. Then we might just open it up for conversation as well. I'm conscious of the time. So we are exploring in parallel to this process some sort of a scientific, global scientific commission process. I'm hesitant to call it a Lancet commission because we haven't had the green light from Richard, but I'm in conversations at the moment with the editorial team. The other options, of course, are Nature and is exploring commission concept, as are a number of the other major global journals. I think the opportunity to have a scientific sort of synthesis and publication, a sort of landmark publication in this space, particularly in the context of the Countdown's recent work, is very timely and important. We are thinking a commission and not a series because I think a commission allows us that deeper, longer, more nuanced sort of dive versus a discrete series of papers. Although to manage, just to temper expectations, whilst a series, and I've been involved now in leading or coordinating 3 series, 2 series and a commission. Whilst series, you can in theory get them out in about 18 months if you're very well organized. A commission, would usually take about 3 years. So the timeline of a commission actually And the strength of it is the process as well as the outcome, and we would sort of align the two and link, but not become reliant, not make reliant the relationship between exploring a protocol and then the scientific synthesis that complements it through a potential global commission yet to be determined. So that's the kind of two tracks. We'll keep that. I don't think we should go into that today because we're still exploring, but I think continue our focus today on the protocol side. Susie, did you have any reflections or?
Yeah. So
Yeah,
thank
great.
you.
Over to you.
Thank you very much. So I think when it comes to, so let's say I'm making the assumption that we're going for an international instrument. And when I was working with Wilfred in the Kobe Center, it was very important for the survival of the center to be latched on to a global initiative, which was at that time the Commission on Social Determinants of Health. So I kind of look at UNFCCC as that equivalent phrase. Now, there are, I think, three, at the national level, there would be three stakeholders that need to converge. The health ministry or someone in health, the foreign affairs folks, and I would think by now all countries have a climate change group or unit or something. So there would be, I think, a role for WHO to what should I say, enable the health ministry counterparts to convene these two, foreign affairs and climate change, and talk about sea level rise impact on health and why there's a need for some kind of an international instrument. Now, the other reason why an international instrument is important for the Pacific is from a human rights point of view. If you have, an island that sinks, then you have an entire population that has nowhere to go. And so under the protocol or whatever it is that we're trying to do, I think we would want to make sure that people have a right to go somewhere. And that means that some of the other countries may in fact say, if you are climate refugees, you can come here. So I think that's part of the discussion. It's like the topography of the world will change if this continues at the speed that it's happening and at the level of unpredictability. And so it needs health to come on board, but it needs foreign affairs to come on board, and it also needs whatever the equivalent is of, in the Philippines, for example, it's the Climate Change Commission. I don't know what it is in the other parts of the Western Pacific, but that could be something that ACE could do, right? Would be to help convene those three sectors, talk about the content that we want, and sort of create at that national level a working group or a steering group that looks at their level of interest, the impact, or what they want to offer. Because for all we know, some of the big countries might want to offer space. I don't know. So it's two things. It's the direct health impact, and the other one is the human rights and the displacement. Thank you.
Thanks, Susie. And before we go to Jose, I might actually just invite Donald to say, because I know Donald has to leave in about 5 minutes. So I might just hand over to you for your reflections as well.
Thanks, Andrew. It's a bit of a higher level discussion than I thought I might be useful in, but thank you so much. I might reflect on a meeting that we had last week, which Sandro joined us for a day. And so just a quick recap. 30 years ago, the Pacific Islands Health Ministers meeting met at the same place that we met last year. And what they established was what was called the Another Island Declaration of the Healthy Islands vision, which I think some of you might have heard. So in this 5-part vision, they'd already where our children learn and thrive. So if you read the 5-part vision, 2 have to do with health. You'd think health, but 3 of this 5-part vision are related to the environment, are related to the oceans, are related to the place. And so the meeting that we had last week was a planetary health forum. And, I know that there's a lot of discussion, unacceptability, or just a lot of debate and dialogue about planetary health versus One Health versus, eco health and things like that. But I think my point would be that when we discuss health, we probably tend to forget that when we're discussing health, whether it's human health, environmental health, we don't reflect on the ecosystems that our people live in as an important means to their livelihoods. And so we're talking about the sustainability of a human being, of a family, and the effect of sea level rise, for instance, on human health. And I think one of the big takeaway messages for us last week, and sorry, this is slightly digressing, but just the importance of recognizing indigenous knowledges and indigenous leaders. And I think that was really, really important, because what we're recognizing in Fiji, where we're currently struggling with a meth problem, and that's driving our HIV numbers at the moment. And we recognize a complete disconnect between our young people and the elderly. And we had a person who was speaking to us who was a culture specialist. And in all of his engagements around at least Fijian communities, he found that the elderly were not connecting with the younger generation. So people don't know what the traditional knowledges are. And I know that this might require a bit of thinking to dive into, but I see that in the long run, for island countries especially, and when we met last week, we just reflected back that was the first meeting of health ministers in Fiji 30 years ago, and they were already talking about the environment. They were already talking about the importance of looking after our oceans, looking after our environment, looking after the places that we live in, as important for health. And that was a health ministers meeting. And so I guess in whatever form this discussion takes, and I know that the discussions will take long, I guess my point would be the importance of utilizing, I think, indigenous knowledges, going back and finding the role of traditional knowledges. And I don't know how this competes, because it doesn't find its place when we talk Western medicine. It doesn't find its place. And so how do countries, how do international organizations, what do they feel about it, and how do they think about supporting countries elevating the role of indigenous knowledges in the discussion, in the dialogue about these environmental or ecosystem issues?
Thanks, Donald. And it's funny you started by saying it's a higher level conversation, but I actually think in many ways that was a very important insight to always remember that we're talking about people and communities, and not get lost in sort of processes and that bigger picture. Because I think particularly at the moment, you can't help but read the news even today. And I think the fact that we've allowed a lot of these issues to become disconnected from people's lives and people's realities, that we've forgotten, or that there's a divergence of traditional knowledge and also impacts on the ground of lived experience, and engaging young people meaningfully in these dialogues and giving them a sense that change is happening, and that they have a sense of agency and power. These are major threats to everything from progress to democracy. So, no, I think thank you for bringing us back to really centering communities and lived experience and young people in the conversation. And I know Bettina and Jose are both nodding because they agree as well. Jose, I might go back to you just for sort of your thoughts, and then we'll open it up. I think if people want to either put up their hand or just, well, it's probably easier to put up your hand because then we can go in order and not miss anyone. But over to you.
Yes, thank you very much. And allow me to start my intervention with Donald's point. You know, and I reivindicate the qualifier of a former bureaucrat with all what that implies. And it's true that we have a pace which is not the same on the field, which is the pace or the requirement for urgency, and the negotiation process to which Bettina has referred also, which is rather slow and so on. I think that we can find ways to speed up processes, even such big processes like the UNFCCC, when a coalition of countries have clear ideas on what they want, how it can be achieved, what are the means that are necessary, and what is the knowledge and the support that may be helpful. And it's true that negotiating a protocol, for example, may take years under the UNFCCC, while on the field, the urgency is there and may not receive immediate response as required, as necessary. So therefore, one of the ideas that would be very operational would be to consolidate the Pacific people process under the UNFCCC and make a lot of advocacy and make the case and make a lot of noise, if I may say so, for advancing this agenda item, which for the time being doesn't exist. So be it for a protocol, be it for a program of work. So coalition of the willing, working under the UNFCCC, making the case, finding the ways, attracting support. And I think that this can be started right now. By the way, AOSIS, the other islands have a specific consideration under the UNFCCC because they have got one position in the Bureau of the UNFCCC as recognition for their threatened situation. So I think that there is a way to go with these coalition under the UNFCCC. A second point, which is most important, and I mentioned, you might remember in one of my slides, the IPBES, the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services. Contrary to the IPCC, IPBES has recognized the value of indigenous and traditional and local knowledge. And this is a step that the IPCC has not yet done so formally and so prominently as IPBES has done. It's because IPCC was developed in 1988 and IPBES using the experience of IPCC in 2012, and we incorporated these points. So the sixth assessment report is referring to, in working group 2 in particular, adaptation to traditional, indigenous, local knowledge. But this has to be systematically worked out on the basis of the magnificent work that has been done under IPBES, how to approach traditional knowledge, how to incorporate, how to give back, because it's also part of the process, how to give back. So we have learned a lot in IPBES on this way to capture traditional and indigenous knowledge, and I think it can be done. I go very quickly to Bettina's point. Fully agree with your analysis and remarks that pace is slow, time is long for the negotiations. The IPCC is a very robust, authoritative body that takes its time. For the time being, again, on a very operational way, taking also into account what Sandro has said about other processes and so on, we could, and I say we, to be defined governments, could request IPCC to draw from the 6th assessment report a technical paper. Is not the last piece of work that will contain the last published scientific work, but it's summing up what the 6 assessment reports say about climate change, sea level rise, health. This can be done in a few months. Is a work for IPCC maximum a year, but this can be done, and this would be helpful. In particular, because there was this special report on oceans, cryosphere, that IPCC did in the last cycle. So a special report in this cycle now, it's over, because they said they will elaborate only 3 special reports. So we may rely on what is in working group 2, adaptation on health matters. But okay, so yes, I think that we have to think about the best way, program work versus protocol, and look how help from this coalition of the people who want to have such an instrument can help in this process. I stop there. Thank you. I think Suzanne is asking the floor.
Sandro, you are muted.
Sorry, my unmute button was hidden behind something that wouldn't close. Technology continues to evade me. Susie, over to you. Thanks,
No,
Jose.
just a really quick comment. I think Jose's points are very important and should really frame what we're going to do. Thank you. Thank
you. Others who haven't had a chance to speak, do you? No one's got their hands up, which either everyone's in furious agreement or we've all fallen asleep. Hopefully the first one. Christy, fantastic. Thank you. Over to you.
Yeah, thanks. I'd like to step back and ask what the overall goal is, because the different approaches will lead to different outcomes, which, as was outlined a little bit earlier by Jose and Bettina, could advance the agenda. But having a clear articulation of the particular goal would really help discussing which particular approach. There were some mentions of promoting research, which is obviously critically needed. Promoting policies, I assume that's policies by health decision makers. Advocacy, awareness, all kinds of issues were embedded in those comments, and just understanding how you would prioritize what you would like to see as the outcome of a program of work, or trying to get the UNFCCC to agree on something. Thanks.
I mean, Susie, I'll allow you and also others. I mean, I'm sort of still getting my head around the full breadth, and conscious also, Christy, that you're a very respected global expert. So my thoughts, I mean, it's that layered sort of ambition that you're talking about. So yes, to build research and knowledge and understanding, but to what end? Then it's about, I suppose, advocacy and keeping this on the agenda of making sure that it's not seen as a regional issue, or even in the current context, a forgotten issue, which I think is increasingly possible. Then it's about achieving policies, and I suppose we at the end of the day, WHO, it's about supporting ministries, and it's about supporting country collaboration and action, and often that is through convening and technical, yes, but it's about policies that change lives and improve health. And the sort of goal, the Rolls-Royce level is then some sort of global addition to the global architecture that further secures expectations, collaboration, future-proofs those through some mechanism, whether that's binding or not. And we've talked about the different options. I think there's the trade-offs then of speed versus complexity and comprehensiveness. Time is of the essence, and also there's so much uncertainty at the moment, particularly just even in terms of losing ground we've already gained, let alone trying to move the dial further. So I think it is sort of, it's not to evade. It almost sounds like a politician answer. I'm not sort of trying to evade the question at all. I think we're really trying to be guided by. I mean, that is in part what we're here to learn, to think about with each of you. There's those 4 layers of ambition, and I think we need to kind of balance realism with then our responsibility to deliver for countries and for communities, and that we don't overpromise and then fail to deliver anything meaningful, but we also don't underpromise or be under ambitious, particularly in the global context, the regional context, and the local context that we find ourselves in. Celia, maybe you have some thoughts on that, or others as well, and then Susie might have thoughts as well, because obviously, part of this discussion actually came from a direct conversation with health ministers across the Pacific, which I think we need to remind ourselves, certainly as WHO, we belong to member states, we belong to the people of our region, and policymakers from our region have asked us to prioritise and look at this issue. And this is one of the first steps that we see in that process. But I'll come back to Susie in a second. But Celia,
I've got a query and 2 comments. The query is, I'm just still not quite sure of the goal. Is it about a protocol or a commission report, or do these dovetail in some way? So I'll just stay tuned to hear, because we probably don't have time to cover that. But I'm interested to hear, I guess, following from Chris's question, what's the output? And I've got 2 comments. One is reasonable, one's just kind of a hope that the sea level rise displacement discussion is really vexed. I guess I would warn to stay away from that assumption that sea level goes up and people are displaced, particularly that people are displaced across borders. As we've seen in Fiji, people will move within countries before they move overseas, and will do anything to adapt and stay in place in the first instance, which of course raises a lot of health issues. And the second is just a thought that I've heard people talking about Indigenous knowledge and community involvement. There's a lot of extremely well-informed and active people in community spaces, like tribal liaisons in Alaska, very vocal chiefs in Fiji. All over the world, there'll be people that could possibly be brought in as kind of perhaps co-authors on a commission report, so that it has that element of bringing community in by people that are affected. So just a hope.
no, thanks, Celia. And so they're 2. I mean, I see them as sort of 2 separate but interlinked pieces. And today, really, the conversations around this protocol concept, we are, as I said, exploring then in parallel and kind of looking at the interlinkages in terms of people, but also processes, a scientific commission. And we've, full disclosure, I've approached Richard about it and waiting to sort of hear his thoughts. And absolutely, I mean, I think being inspired by the work, including of the Adolescent Health series with Susan Sawyer, of looking at embedding lived experience voices and looking at different forms of commissioners. In that case, it was youth and adolescent commissioners, but I think community commissioners is something that is already in my mind, and we can definitely pick up the conversation further on. I think any commission that is top down or forgets to really place the community and lived experience voices at the centre would be a huge missed opportunity. I know Susie feels the same, but you've got your microphone off, so I'll let you just add your thoughts.
No, that was just great. That's great to hear.
Thank you. Wilfred, were you about to say something?
Yes, just a few comments. I think what is crucially important to have a clear response from our member states as to what they would like to see as a major, let's say, way to give health a central role in the mitigation and adaptation efforts. I think that is the key question there. And it would definitely be important to submit to the member states the two options we have been discussing now, namely a protocol, a legally binding instrument, which, as we have seen, as we know, would need time negotiating it and so on and so forth. And secondly, yes, the work program based on the Nairobi work program, what would be the advantages of this versus the protocol? The member states would need to give us the guidance of what we should develop. And I think the question also is the World Health Assembly and the Regional Committee, when they discuss the work program under the WHA 7714 on climate change and health, could in fact refer to these two issues and to arrive at a decision, maybe at the regional committee or at the World Health Assembly, as to which way we should go. So we need to come to that question pretty soon, because we know health has to be given a central role. And I was in Rio in 1992, and I'm sorry to make reference to the Rio Declaration. Article 1 says human beings are entitled to a healthy and productive life in harmony with nature. That's the wording, but so far health has not been given the central role. That's the key issue. We need to come to that point when health is being debated and not issues which are not central to climate change.
Thanks, Wilfred. I mean, Susie, do you have any thoughts in terms of from the WHO side and sort of process-related reflection?
Yeah, on the ground, right, when we're looking at countries, the health sector, they have not, what should I say? They have not internalized the impact of climate on their work. So we talk about it, we know it, and all of that. But right now I'm looking at the television, there's a flood in Indonesia. It's reported as a flood in Indonesia. You know what I mean? It's like we need to so we need to find a way, and this is why we thought about some kind of an instrument, right? Was because we are losing time. I think for action, health is needed to be there, as Wilfred says, at the center of the discussion so that governments will do something about it. Now, sea level rise came out because we are here in the Pacific where it is a huge issue. And there are some studies that show that there are some countries that could really go underwater. And in fact, some countries are buying land in other places where they have money, they're buying land. So now we also know that and Christy knows this probably so much more, that a lot of communities live underwater certain times of the year. So they don't move. So what Celia is also saying is correct. They don't move. But this is becoming worse. And I think we're looking for, even if we say a treaty takes a longer time, the advocacy value of it is high, right? In fact, there was a New York session on sea level rise last year at the UN General Assembly. What extent it talked about health, I don't know, but it did come out. And for me, I just think that health systems in this region, they know there's climate change, but it's not integrated into their work. So we have to move everyone into that direction quickly. So I think, you know, the prominence or the visibility of an international instrument can nudge people into, and governments, and gives WHO an opportunity to convene and to get people, yeah, they have to act.
Absolutely.
Thanks, Susie. Any other final remarks before we start to close? Bettina, do you want to, I mean, I think maybe also when we spoke, you really just spoke, you reflected powerfully on the relevance also of this topic for your part of the world. And I think it is absolutely front of mind for the Pacific, and it's thought of often as a Pacific issue, but we are very concerned, obviously, for a number of, well, we reflect the concern of a number of member states in our region. But I mean, how you're seeing this from a different hemisphere and the relevance of it for the European region and the work WHO is doing there. Maybe just a few minutes, and then we'll start to summarize.
Answering to Chris, and I agree with everything I've heard. I mean, for me, the call here is for solidarity and urgency. So this needs then to be framed, of course, into the right way. Europe has, you know, there are numerous scientific papers on sea level rise, right? But if you look at what the Budapest statement, for example, I mean, sea level rise is not part of it. Maybe it is mentioned somewhere, but it's not something the European countries think about in terms of urgent need for action. Okay, so something very important. While a substantive amount of areas will be affected by sea level rise in the years, decades, whatever it is, depending on the scenarios. But it's not yet considered as an urgent problem to address. So currently we have heat waves, we have the flooding, you were mentioning it, we have the changes in the ranges of infectious diseases, and this big issue about making our health systems more sustainable. Okay, so the climate, the system resilience. So it didn't get into, it's something seen very far away, okay, in Europe, while it is a forthcoming problem, okay? So I believe that the whole, if the Pacific Islands, if the Western Pacific region could really raise the attention to this problem, I'm 100% sure we will get Iceland, Malta, just to mention a few, Cyprus, some of Spain, France, etc. So the ones bordering the big oceans also getting engaged, okay? Because they will be facing the problem, where do we put our people, okay? And so that would be for me to go at it. And then, of course, you have the other regions to be engaged. Some of them more exposed, other than less exposed now, but in the future years, definitively. So that would be my answer to this. And if you start raising the attention, I'm sure we'll be getting on board under the concept, under this big issue of the bigger need of solidarity we need today.
Thank you. Thank you so much, Bettina. Ivan.
Thank you, Sandra. Thank you, everyone. It occurs to me that this is a really important time. We're running out of time to centralize the urgent push for global warming mitigation. After this point in time, we will be doing adaptation and moving people around. So that foregrounds the goal for me. The definition is then mitigation, and I wanted to tell you about how Australia got its carbon tax. I mentioned my first work in the early 2000s on an Australian and broader regional climate risk assessment on health in 2003. And then I mentioned the 2008 Australian National Economic Impact Assessment. That was at the culmination of our worst drought in hundreds of years. In 2009, the political framework was ripe. The public sentiment was there. The opportunity was made available for strong, courageous leadership in the form of our politicians and also the leaders of the research community who had been doing that climate risk assessment work for the decade leading up to that. My boss had a personal invitation to go to the Prime Minister's office. And that year, the framework was generated, and a year or two after, we had a carbon tax. Unfortunately, a couple of years after that, we had no drought, lots of rain. The Conservative government got in and repealed the Australian carbon tax. Now, I'm reflecting on this as an example of what we can achieve and what we probably need to understand how that worked. We had the groundwork done, the scientific evidence was prepared and publicized very effectively for a long time leading up to that. We had the public's attention because there was real environmental crisis at their doorsteps. We had a receptive political class engaged with the leaders of the research community. And in that window of opportunity, things happened. Now, I don't know, I'm a public health researcher. And I admit to being disillusioned with the processes of negotiators and diplomats making a meaningful difference over very long time periods in certain committees and panels. I think there may be an opportunity to conceptualize the moment that that window of opportunity opens and be prepared to push with the courageous leadership and the bringing together of the components that I've just outlined. And I haven't heard anyone talk about the UN's 2024 report, which was very effectively publicized, Surging Seas in a Warming World. That made a big impact on the news I was listening to, and Celia's point was very strongly made that all of those people that were being attributed to the impacts were moving around within borders. That's not going to get people's attention as much as the smaller but highly visible groups who will be displaced and refugees. So I think if there is a group of people about to move, that might be the start of that window of opportunity opening. And I'll leave it there. Thank you.
Thanks, Ivan. Susie, any final remarks? Otherwise, I might just summarise and close out.
Go ahead, Sandro.
Well, thank you, everyone. It's been a rich and generous and comprehensive and challenging discussion, and 90 minutes has flashed by. I think we've got some clear actions for the Secretariat, and we will take it upon as an action item for ourselves to send some key insights and some sort of proposed next steps once we've had a chance to digest and summarise. We have a bit of work to do, clearly. We've heard there is a need to, I think, specify and really clarify the goals, to understand the two streams of work that we're exploring, how those interact, and also, most importantly, how those amplify and catalyse one another. I think comparing the different negotiation processes and understanding, how we might achieve them, what the trade-offs are, and what as WHO, together with partners within and outside the UN system, we're able to do as we continue to work to support the health, the fairness, and the lives of communities across our region. I think we do need to make sure that we continue to gather opinions and insights from our member states. As I said, comparing protocol options and programs. We'll also, as mentioned, engage with ministers and ministries, health and outside, and look at sort of, I suppose, a forum or some sort of gathering that allows us to continue these conversations. I think as a next step, and also I think there was a very clear call from Celia, from others, echoed by Jose and Susie and Bettina, that we need to also make sure that we don't lose sight of the local and of the community voices and the Indigenous perspectives and ways of knowing and doing that Donald reminded us of, that local is not the antithesis of global, but in fact the two are really interlinked and interreliant. And I think that will be a strength of this work and of both streams of this work. So with that, thank you again. There's quite a lot for us to take away. Wilfred, given that you kicked this whole thing off, I'll allow you to say, in 30 seconds to give any final thoughts, and then I'll thank everyone and close and let everyone get on with their days. Wilfred.
Well, excuse me. What I heard today is encouraging in many ways, that we as WHO are ready to undertake action for the health of the people of this world. And as I indicated in the Rio Declaration, we already laid the foundation for the work that we are now supposed to do. I would like to really see a decision of the regional director and the director general as to which way WHO should move. And we must give them the background in order to take that decision. I think this is the way we should go, because as many people mentioned, it's not only the Western Pacific region, it's all regions which are affected, and we need to have them all on board. I think that is WHO as an organization to have that task ahead of us.
Excellent. Thanks, Wilfred. Well, on that note, very inspiring note, just again, a very big thank you to everyone. Late at night, Christy, early in the morning for our European colleagues. I can see the sun streaming in the window behind Rocco as the morning dawns. Thank you, everyone, for your time. We'll be in touch with a summary and some next steps in due course, and you will hear from us again. That's our commitment on this topic, and we really appreciate your continued collaboration. Thank you.
A pleasure to be with all of you.
Thank you.
Thank you.
Thank you.
Bye, everyone.
Bye.
Thank you,
Okay.
everyone.
Bye.
Thank
Thank
you.
you. 감사합니다.
감사합니다. Thank you, Jose.
You're welcome.
Thank you. Thank you, Fred.
Okay. Bye. Bye. Wilfred.
Bye. Thank you.
Bye.
Thank you, Fred. Thank you.